What's going on?
What's up?
Why are you laughing at me?
Your shorts.
My mom picked these out for me. You look like a girl.
You look like
No, please.
This bruise is medial toward the midline of his body in relation to his wrist, where the injury to his ear is lateral or away from the midline in his nose.
There is a scrape on the elbow that is There's a scrape on his elbow that's proximal or close to the limb's attachment point to the fingers. It looks like there is a break on his foot, which is distal or further away from the body attachment point to the thigh. The scratches to his skin are superficial or towards the body surface to the lungs, which seem to not have any trauma.
From his fall down the stairs, kidney ribs are broken away from the body surface or deep in relation to his pectoral muscle.
Let's reassess the injuries. In the dorsal body cavity, which protects the nervous system and includes the cranial and spinal cavity, we have damage to the brain, which is in the cranial cavity that is within the skull and encases the brain. We also have injuries to the vertebral cavity, which contains the spinal cord. Here, in the ventral body cavity, or the front side of the body, we can see he has done some harm. Within the cavity, the thoracic, heart and lungs, and abdominopelvic, stomach, liver, pancreas, etc. cavities are found.
Along the sagittal plane, we can see the division between the right and left sides of the body. There is some bruising from the fall. This is especially visible on the mid-sagittal plane directly in the middle of his body. The frontal plane is the cut that divides the body into anterior and posterior, which is front and back, unlike the transverse cut, which divides the body into top and bottom. The right upper quadrant, which appears to be on the left when looking at the body in anatomical position, contains the right side of the liver and right kidney. The left upper quadrant, which is located directly next to the right upper, contains the left kidney, colon, and stomach and spleen. Below the upper quadrants are the lower. Here is the right lower quadrant, which contains the appendix, located next to the left lower quadrant, containing the left iliac fossa.
For a more specific reference, you can break down the abdominopelvic cavity into 9 regions. For the right hypochondriac, contains the liver, gallbladder, right kidney, as well as the small intestines. Medial to that is the epigastric region, including the stomach, liver, and pancreas. Next is the left hypochondriac region, which has organs such as the spleen. Inferior to the right hypochondriac region is the right lumbar region, which has the liver and gallbladder. In the middle is the umbilical region, home to the small intestines. Lateral to it is the left lumbar region, which includes the left kidney and the colon. Inferior to the left lumbar region, we have the right iliac region, which includes the appendix. The appendix! To the right of the right iliac region is the hypogastric region, which has the most of the bladder and small and large intestines. Finally, we have the left iliac region, which contains the stomach, liver, and pancreas.
He did.